Good afternoon, my name is Tiffany. I'm going to talk to you about the benefits of sulfonilamide. Was discovered between 1930 and 1940 by Heinrich Hertling. The first formula discovered was Prontosil in 1932 by the Bayer Laboratories. This antibiotic has saved the life of dozens of patients during the Second World War and has saved the life of Franklin Delano Roosevelt Jr. and Winston Churchill. In the war, the soldiers has scattered the antibiotic like a white powder over the open wounds of the other soldiers. This is a bacteriostatic antibiotics and inhibits the synthesis of folic acid in the bacteria. The organisms become resistant by mutation or gene transformation. Also, they decrease the wall of the cells, and genetic alteration of the enzymes that makes folic acid prevents the acquisition of plasmids or DNA, and some resistant cells like somatic cells are resistant because they do not need the acid folic to survive, and other organisms create their own folic acid, so they are resistant because they don't need to make folic acid. Another external sources can be used to be unaffected by the antibiotic, and the scientists has discovered recently resistant strains in organisms, and they use like a treatment synergism. This is treatments of two or more antibiotics to treat resistant strains. One example is the use of sulfas and the trimetoprim to treat resistant strains in organisms. Some side effects on the organisms are rash, dermatitis, photosensitivity, itching, nausea, vomiting, and diarrhea. They can develop serious symptoms like kidney stones, hepatitis, hemolytic anemia, renal failure, renal tubules, urinary tract obstruction. Pregnant women cannot use this antibiotic because it is antibacterial and toxic effects to the fetus. The baby dies. In only 1% of the patients, they develop Stevens-Johnson syndrome. We can see the effects on skin, internal organs, genital areas, mouth parts, and cutaneous areas. Some uses of the sulfonamides are orally to treat urinary tract infections, ulcers, toxoplasmosis, and arthritis. In cream, we use it in burn infections, eye infections, and acne. Patients under 6 years old cannot use this antibiotic because they can have renal failure, and in pregnant women it can cause toxic effects to the fetus. In conclusion, we need to find another formulas because some antibiotics like this one can cause lethal effects over the patients who use these antibiotics. So we need to find out other ways to prevent infections and sickness, like prevent a good hygiene, good handling of food, try to avoid contact with contaminated people or contaminated surfaces. And thank you.